The third thing which we need to do, and this is perhaps the most important, and this is where I'm a little worried because it's the only area where I'm a little worried because I don't think the either the health ministry or the policymakers in charge, right? I mean, there are three people who have effectively guided India's response to COVID: the AIMS director, the ICMR DG, and the member health in the planning commission. And I don't
Right.
see any of them talking about boosters. And this worries me. You need to boost the entire adult population, and you need to do it as soon as possible. You need to give them a third dose.
Hi, you're watching Hindustan Times. I'm Aditi Prasad. After a peak and a decline, global statistics show that COVID 19 cases have once again started rising. Now, the current spike is being led by soaring infections in several countries, including China, Hong Kong, South Korea, Australia, even. So basically, it's Asia, Oceania, and Europe, which is leading this resurgence in sort of global numbers. Now, the pandemic numbers in India, however, are clearly, and might I add, thankfully, defying the global trend for now. Joining me right now is Hindustan Times editor-in-chief Sukumar Ranganathan to understand whether this is purely due to the fact that we've done near saturation levels of vaccinations in adults, or is there more to it? Sukumar, straight over to you. I think my question is implicit. The global COVID curve is clearly facing another resurgence. What factors are contributing to it, and does India need to worry?
Um, okay, let's start at the beginning. And I
Right.
think it's important to understand why cases are peaking in all the regions where you said they're peaking. And it's happening for multiple reasons, right? I mean, it's not happening for one common reason. One reason it's happening is because there were a few countries, and the countries that come to mind are countries like Hong Kong, China, New Zealand, Australia, which had significant restrictions in place. Australia and New Zealand, for instance, had completely banned travel. You couldn't, even Australians who left Australia found it very difficult to get back to their home country, right?
Hmm.
And so, which meant that exposure to the virus was almost non existent in a huge swathe of the population. It works as long as you don't encounter a strain which is as infective as Omicron, right? And everyone in India knows what Omicron does, so I don't need to elaborate on it because I think,
True.
um, I mean, we all know like so many people who got infected in this recent third wave, which is now fortunately behind us. It's milder, but it causes infection, so that's one reason why it's happening. The second reason it's happening is because some of these countries, and the UK is an example of this, have completely done away with restrictions. There are not even mask mandates, even indoors in many parts of the UK. Clearly, that results in some level of infection. Again, it's Omicron, it's a mild strain, don't need to worry, but it is causing numbers. The third reason it's happening is because you're seeing this surge in some countries, like Germany, for instance, which were early adopters of vaccination, managed to vaccinate a huge proportion of their population very early. Korea is another example. And that efficacy is waning after two doses. Sure, some of these countries have also provided boosters, but they've not boosted the entire population. And if you distill down the surge, you're finding that a lot of it is happening in people who have got two shots who have not got the booster yet. So that's a third reason why it's happened. Which
Yeah.
leads us to the obvious question: does India need to worry? And I wouldn't use the word worry. We've all worried for 2 years, right? I mean, we've become a country of worriers, and I don't think we should worry anymore. But we need to be careful. There are a few things we need to do. The first thing we need to do is, I think we need to wear masks in indoor areas. And this is extremely important. Even in our newsroom, for instance, which we now shared with a lot of people from some of the other departments, I see a lot of people wandering around without masks. And I've tried telling them, no one listens, and that's the case everywhere. But in an indoor environment, it makes sense to wear masks. Uh, Offices that reopen need to make sure that their air conditioners have good filters, which we've made sure. Uh, need to make sure that there's adequate ventilation. Not always possible in all offices because India loves these glass and chrome offices where you can't even open any
Yeah.
windows. So we need to do those things because indoor areas, it makes sense to take these precautions. Outdoors doesn't really matter. Social distancing, indoors perhaps, outdoors don't really need to worry about it. Restrictions on interstate travel, intercountry travel, international travel, I don't think any of that is needed. That's the first thing that we need to do. The second thing we need to do is we need to sequence genomes very, very aggressively, the viral genomes. This was something that we did not do at the end of the first wave. And a lot of us kept writing about the importance of doing this. No one did it till it was too late. And then suddenly Delta was upon us and it just ravaged the country. So I think, and fortunately this time, I think we've learned our lesson well. Um, Today, for instance, we have a story in Hindustan Times about how the health ministry has said that we are going to continue to sequence viral genomes very, very actively. So they're making sure that although we are seeing very few cases, they're making sure that these genomes are sequenced so that we know if there are any possible new variants which we need to be worried about, which is something that we need to do. The third thing which we need to do, and this is perhaps the most important, and this is where I'm a little worried because it's the only area where I'm a little worried because I don't think either the health ministry or the policymakers in charge, right? I mean, there are three people who have effectively guided India's response to COVID: the AIMS director, the ICMR DG, and the member health in the planning commission. And I don't see any of them talking about boosters. And this worries me. You need to boost the entire adult population, and you need to do it as soon as possible. You need to give them a third dose. I know that the US is now talking in terms of a fourth dose. The latest research shows that the fourth dose not really needed, but three most needed. So I think it makes sense for us to have a policy in place for providing boosters to the entire adult population. I do not think the population under the age of 18 needs it. I'm also not sure that the population under the age of 11, because the way India counts 12 is for us, anyone is considered to be 12 if the person was born in 2010, which means anyone who's finished
Right.
11 is actually considered as part of 12. So I think under 11, you don't even need to consider vaccination. You know, the research is still not completely in favor of that. So I don't think we need to worry about that. But the only thing on which we really need to move fast is we have to ensure that the entire adult population gets the third dose.
This third dose or the booster that you're talking about. And possibly that ties in also with the fact that there are nations like Switzerland, UK, Germany, France. They've already experienced one strong Omicron surge, and now they're experiencing a resurge of infections, and that. And many experts, we've written in Hindustan Times that that's because of the waning, perhaps because of the waning immunity because of the two doses. So therefore, the need for a booster is, I mean, is just tying into
Exactly,
your point.
exactly. That's one of the reasons why some of these countries are seeing a surge, and it's exactly why we need a third dose. You know, I'm not advocating a third dose because someone came to me in my dream and said, you know, this is what you should say. I'm
Right.
saying it on the basis of science, and I'm a little surprised that the wise men in charge of India's vaccine program are not seeing this. It's something that's extremely concerning because at this point in time our infection level is the lowest since May 2020. Now that's a big deal. I don't have the data because there's just been one day of vaccinating people who are 11 plus. But if you were to look at the 14 plus age group, because when we say 15 plus, we actually do 14 plus. When you look at the 14 plus age group, 80% of them were fully vaccinated, and another 16% of them had got one shot. So 96% we've covered. So we are well on our way to almost vaccinating the entire population over the age of 14, and subsequently we'll do it over the age of 11 also. The one big gap, and you know, I know that we are doing it right now for people over the age of 60, but there's no talk of doing it for
Right.
people over the age of 45, people over the age of 18, and you have to do it all because last year the vaccine was opened up progressively. And even those over, let me ask you, when did you have your second shot of the vaccine?
It's been 2 months.
Okay, so for you, it's
I
not
was
so
a late.
bad.
I was a late one. Yeah.
Yeah, but there are people who had their second dose. Or let me give you my example. I had my second dose of the vaccine in July last year, right? So so that's a significant period of time, right? I mean, it's 8 months, and vaccine efficacy wanes in 4 to 6 months. At least that's what research says, which is why everyone is saying, please give people boosters. And
Hmm.
at this point in time, there's no shortage of vaccines. We have an excellent mechanism in place for administering the vaccines. So, quite honestly, I am at a loss as to why we are still not vaccinating people, giving them the boosters, and
Hmm.
because it's a big risk. It might not cause the kind of fatalities that we saw in the second wave, but if you have a surge in infections, it's going to disrupt activities, it's going to disrupt the economy, it's basically going to disrupt life and work. And you don't want that to happen. You've just reopened your schools, you've just reopened your colleges. People have just started going back to work, right? People have started working from office again. And all of that will be disrupted again if we don't do this.
And perhaps just to there is also the additional aspect, Sukumar, of the evolution of the virus in itself. I mean, who knows what's going to come tomorrow? I mean,
Yeah, but
Omicron
see,
maybe.
I again, but on that front, I think we are doing the smart thing in sequencing the
Right.
virus. As long as we don't let up on that, I think that should be fine. That's a lesson that we've learned well. But like I said, I can't explain why we've still not announced boosters for the entire adult population. I know it needs to be done sequentially, but by now we should have vaccinated at least half the population over the age of 45. We've not even announced it to them. People are not eligible.
Right. Clearly, a lot more needs to be done. I mean, there's a lot that has been done, not taking away from the fact that the government has taken after the deadly second wave, the government has taken into account a lot of things, and the vaccination program is one of those things which have gone on very well. At least in for the population above a certain age group and the adult population particularly. But as far as boosters, as Sukumar is pointing out, boosters are a cause of worry, and we definitely need to get there. And nobody, as Sukumar is suggesting, is talking about it right now, and we definitely need to start talking soon enough. Thank you so much for watching this broadcast. Stay tuned to Hindustan Times.